you, my dear friends. Greetings from Community Positive Health Attitude Initiative. My name is Professor Ede Ndebwago. I'm a professor of public health medicine. And then today we are going to be talking about cancer of the cervix. Cervix, incidentally, that part of human, female reproductive organ, is a part of the womb, is the end of the womb that opens into the vagina. You have cancer in this organ when the cells starts growing abnormally. This cancer is really one of the bad cancers that kill women if undetected early and handled, you know. So this cancer, incidentally, is the fourth most common cancer among female all over the world. And then you find out that 90% of new cases occurring in this cancer occur in low and middle income countries. So that is why it's a big issue, and people in these areas should really watch out for it. And then this cancer grows slowly. You know, it goes through different stages. It goes from what we call a cervical dysplasia. The cells of the cancer starts getting some changes. And this thing can go on for some time before you have a stage they call carcinoma in situ. Carcinoma in situ, again, is like a hidden cancer. It's there, but it's not overtly cancer. Something can be done to stop it. But if nothing is done, that carcinoma in situ can stay for about 8 years. If nothing is done about it, it then progresses to invasive carcinoma. And once you have this invasive carcinoma, my dear friend, then it's a problem. So we are doing this to raise awareness so that people, women, there are simple things you can do. We'll talk about that later to detect these problems early and stop it. So having given you the basic facts about cancer of the cervix, let's now talk about the risk factors. These are the things that will make you get this cancer. These are the things that will predispose you to getting this cancer. Incidentally, nobody can pinpoint the definite cause of this cancer of the cervix, but there are things we call risk factors. These are the things that make it possible for you to have this cancer. And then if you come to these risk factors, there are ones we say are modifiable risk factors. These are the ones that something can be done about to stop it, you know, to stop you getting exposed to it and having cancer. There are the ones that are unmodifiable. Incidentally, there's really nothing you can do about it except to try and screen and detect the onset of the cancer and then treat it early. So let's talk about the modifiable risk cancers, the ones you can do something about. We start with infection with human papilloma virus. Incidentally, this is one infection that you find out in 95% of cases of cancer of the cervix. This infection is associated with it. And this infection is got through sexual intercourse. So whatever you can do to prevent getting infected with human papilloma virus, it is a very big step towards preventing one from getting cancer of the cervix. The other risk factor you have is early exposure to sexual intercourse. You find people, scientists have found that people who start sex earlier than like 18 years, they are more prone to getting cancer of the cervix. I mean, people like willing voluntary sexual intercourse, not people who were raped or had accidental sex before the age of 18, but people who voluntarily initiated sexual activity, they are more prone to having cancer of the cervix. Of course, you know, the chances of their getting more human papilloma virus infection is there. Then, the next group of modifiable risk factors is again people who have multiple sexual partners. You know, the more sexual partners you have, the more you make it possible for you to have this human papilloma virus infection and then get cancer of the cervix. Of course, the more you have different, you know, male organ traumatizing your cervix and causing certain things that can cause dysplasia and make you have it. Then, the other modifiable risk factor about this cancer of the cervix is when you have infections, sexually transmitted diseases that are poorly treated. Like there's one they call chlamydia. Chlamydia has been highly associated with potentiating the activity of the human papilloma virus. All the other sexual infections like syphilis, all of them. Still talking about the modifiable risk factors, you find out that people who have given birth to more than 3 children, you know, they are prone to it. Because the more you give birth, the more you're exposed to sexual activities. And it's been found out not only that you're more exposed to sexual activity, but it's been found out that cancer of the cervix is a bit somehow associated with activities and hormones that play around in pregnancy. So the more you have children, the more you're exposed to having cancer of the cervix. Then another modifiable risk factor is tobacco smoking. This tobacco, we keep mentioning it. Most of the cancers, tobacco is a risk factor. So because tobacco in a way reduces the woman's immunity and makes her more prone to the effects of human papilloma virus and the other things that play around cancer of the cervix. Generally, reduced immunity is a modifiable risk factor. It's been found out that women who have HIV infection, their immunity is low, and these women are 6 times more likely to have cancer of the cervix than the people who don't have it. Of course, women who take some drugs that suppress their immunity, people who continue taking steroids, these things suppress their immunity, and in the long run, if there is heavy taking of these drugs, can predispose them to having cancer of the cervix. These are all modifiable risk factors. Of course, you have it's been found out that this disease again is commoner in low socioeconomic group, for so many reasons. Even low socioeconomic group people, they hardly can afford screening, the things that the other people do to pick the disease early and then abort it, One other key modifiable risk factor is having a male partner that is uncircumcised. They transmit this human papilloma virus infection more, uncircumcised male, So if your partner is uncircumcised and you're a female, you watch out. You try and screen more for cancer of the cervix. One or other modifiable risk factor is ladies that use oral contraceptives a lot. These things are steroids too, and they predispose to having cancer of the cervix. Again, diet, unhealthy diet is a risk factor for so many cancers, including that of the cancer of the cervix. It's advised to take diet rich in fruits, vegetables, and then very low in saturated fats like red meat and all that. Diet rich in grains, whole grain and all that. They're good diet. So your diet says a lot about whether you get cancer, different kinds of cancer, including that of the cervix or not. So these are the modifiable risk factors. Then we can look at the ones we say are unmodifiable risk factors. Primary among them is age. It's been found out that this cancer occurs mainly in people who are 25 to 45 years of age, So this, you can't do anything about your age. The only thing we advise is that if you're among that age group, try as much as you can to get screened, and then detect the problem early so that you can nip it in the bud. Of course, people who have family history of carcinoma of the cervix, people whose mother or any of the sisters or close relatives has had cancer, they are more at danger. And because it's unmodifiable, these people are advised to, be on the watch out. There are simple tests. We'll talk about that later. You do, to pick this disease early and nip it in the bud. It's completely curable if you pick it early enough, Then again, the other modifiable risk factor, the other unmodifiable risk factor, the one you can't do about is that people whose mother took a drug we call diethylstilbestrol. Incidentally, around 1938, this drug was used to treat miscarriage, to prevent women, especially in US, from miscarrying. From 38 in US, and so many other countries kept using it. But America, their Food and Drug Administration people, they stopped the use of this drug as far back as 1971. But in so many of these low and middle income countries, people kept using it. So you find out female children who are born, whose mother used that drug to prevent them from getting miscarried, usually end up having what they call clear cell carcinoma of maybe the vagina and then the cervix. So these are the things. So anybody that has a history whose mother took that drug should be on the watch out, and then keep screening any sign of cervical cancer because it's treatable if detected early. Then you take action. So those are the modifiable risk factors. Well, my dear friends, please, that's a message from us, from the Community Positive Health Attitude Initiative team. The whole essence of we doing this is to create awareness and let you stay alive. Please, cervical cancer is curable. It's a beautiful news. It's curable. But you need to do the needful. And the needful is that you need to get screened and pick it early. You get screened by doing what they call pap smear. That's the commonest. There are other screening tests you see in some of other videos. You do screening, you pick it early. Again, there is vaccine. This is beautiful. There is vaccine to prevent cervical cancer. And this vaccine is vaccine for human papilloma virus infection. It's given in most health facilities. Actually, the WHO advises that from 9 years to 14, they start taking this vaccine. It can be given up to 45 years, women who are up to 45 years. And the vaccine has been shown to be proven to be effective. Dear ladies, please go and get this vaccine. Let your girls, your daughters, your relations, anybody that you know get this vaccine and let them get screened too. We keep saying we love you. We really love you. And it's obvious your relations, friends, family, they love you too. We all want you to stay alive. But don't make this mistake of always saying, it is not my portion. It can be anybody's portion. Anybody can get the disease. The needful is within you to stay alive, please. Thank you so much. We love you. Saying bye-bye to you, my dear friends. Remember, I'm Professor Edin Dibuago, your Professor of Public Health Medicine. Thank you so very much.